Earlier, I labeled it from pale to pink mission. Now I have written only mission pink for adolescent girls. I'm subject to comments, and because ये PPT को बढ़िया होना है, इसलिए हम आपके each and every comment will be there right from this particular topic, whether it should be mission pale to pink or mission pink. ठीक है? Now coming to anemia. Anemia is a silent epidemic adversely affecting the health of young individuals and economic growth of many countries. We know that India has got 50% of population is less than 25 years. हमारी population जो है 50% is less than 25 years. It is the severe anemia, and it is the world leading cause of disability. It is severe anemia which kills the individual. The physical, the cognitive losses due to anemia cost a developing country up to 4% of the loss of GDP. It means it will be slightly less than the total budget spent on education and health in our country. So that will be the loss. Why we should talk about adolescent today? They are 1/5 of the world population. They make 85% of the population. They are living, 85% of them are living in developing countries. And as far as India is concerned, adolescent population makes 21% of the Indian population. When I talk about this group, it is from 10 to 19 years, less than 20 years. Adolescents are the most precious assets. So adolescent, when we're talking about, you should be very specific which age we are talking about. And they are the most precious asset, and no government can ignore their health. So you can see here that adolescent boys and girls make 21% of the population of this country. And as for the adolescent girls they make 10% of the population of this country, for which you and me are responsible to take care. Now, here I'll say that there should be mission 12-12. 12 साल को 12 ग्राम hemoglobin होना जरूरी है. So hemoglobin of the girl should not be less than 12 gram percent. Ideally speaking, it should range from 12 to 15. If Western world can have a girl of 15 years, then why not we? And as for the boys is concerned, the hemoglobin should not be less than 13 gram percent, but the range should be 13 to 16 gram percent. Now, as far as anemia in adolescent girls is concerned, it is causing a red alert, and India is a super capital of anemia as far as the adolescents are concerned. You can see here that WHO says that 45% of the adolescents in general are anemic in the developing countries, while 60% of adolescent girls are anemic who have a less hemoglobin, less than 12 gram percent. Now I will show you my own experience in the last 60 years. When I joined medical college, we had in physiology department, all of us had hemoglobin. And I remember very well that the professor of physiology was Dr. Malik, and he said 90% of you are anemic. And that particular time he asked us to make a pledge that you will improve your hemoglobin to 12 gram percent, and see to it that your students also are more than 12 gram percent. At that particular time, when we joined at the age of 17 years, we were adolescent. In 2000, we under DGF, Dr. Sharda Jain team did screening of almost 22,000 people in the slums in East Delhi, and we found that 90% of the children, adolescents, and the women were anemic. And in National Family Health Survey 5 has showed that in 2021, the incidence of anemia is 59% plus. So this is what you can see when our adolescents' hemoglobin status is like this. It has not changed very much. You can see here, this is in year 2000 when we did this particular study, and this is the study which created a havoc. We presented in Indian Medical Association. Then Indian Medical Association took a mission of movement against anemia. Then you find Foxy followed it up, and pediatricians also equally followed it up. A lot of work had started happening at that time. And you could see here at that time, the 50, less than 50, almost 50% were mildly anemic. It means इनको बस थोड़ा सा काम करने की जरूरत है. And significant number was moderate to severe anemia. Only 12% were normal at that particular time. And you could see here, this is makes them difficult to concentrate. That's why their school performance is bad, and it makes them lazy. They पढ़ने को बैठते तो उनको नींद आ जाती है. This was in 2000. In 2000, again, we did a study in the Delhi University, and we found that 90% of the Delhi University girls who volunteered for blood donations were rejected because their hemoglobin was less than 12.5 gram percent, which is the level for blood donation. We tied up with the Rotary Club, and they used to do a lot of blood donation camps, and this was the result that we found that almost 90% of the Delhi University girls were volunteered in 2000. We are talking about 2000. And now you could see that this is a National Family Health Survey 5, which shows adolescent girls' hemoglobin, which are people who are in the 15 to 19 years, is 60%. So this study of National Family Health Survey was a very disturbing, because not only adolescents, all children, pregnant women, non-pregnant women, all were the anemia increased by 5 to 9%. And again, our target, which we're talking about, is adolescent girls. Now, when we know that in any country, 1 in every 2 adolescent girls suffer from anemia, it is affecting their school and the college study grades. ये सबसे पहले हमें बात याद रखनी है. Now, so all of us need to wake up and work for Anemia Mukt Bharat as far as these adolescent girls are concerned, and we must know the facts first before we started working on it. Now, my purpose and my aim of delivering this particular talk is to explain to you on these 3 slides. The WHO says that in case a person has a mild to moderate anemia, even if there is a mild anemia, it causes tissue iron deficiency. And this tissue iron deficiency first affects the child's skeletal growth in the form of child development. It affects their concentration power, their attention, and that's why their school performance goes down, because the brain requires oxygen, which is 20% oxygen. The rest of the body, it can be anything, but the brain requires 20% of the total oxygen requirement of the body. And thirdly, it badly affects their work performance. They become lazy. And these are the 3 things nobody can forget to remember, that it affects their skeletal growth, it affects their school performance, and it affects their work performance. It is the severe anemia which kills, whether it is in children, whether it's in adolescent, whether it's in a pregnant lady, whether it's any age, irrespective. Whenever the severe anemia is there, then it kills them. The killing part comes only in the severe anemia. Now, this is again $1 million slide like the previous slide. You can see here, there is a storage iron, which is there in the liver and the reticuloendothelial system, mainly the bone marrow. And there's a transport and a functional iron, which is there in the form of hemoglobin in the blood, myoglobin, which is the big chunk, and cytochromes, all enzymes and things like that. Now, I want you to only go through this 3 investigation. One is serum ferritin. The normal range is up to 60. Transferring saturation, which is 35, and hemoglobin for a female is more than 12 gram percent. For a male, male counterpart, it is 13 gram percent. Now, whenever you have these 3 parameters all normal, shows that everything is okay with this particular person. Now, you find that the ferritin level have dropped and they have dropped below the critical level, which is 15. 15 is the serum ferritin level, which if it is less than 15, it shows that the storage iron has become zero. It has become, the storage iron has become zero. And the storage iron ka jo only investigation is, it is serum ferritin. This shows that this lady still has a transport and a functional iron there, and that is why her transferrin saturation is normal and her hemoglobin is also normal. Now, there is a stage comes when you find that transport iron, especially the muscular myoglobin element, goes down. In that particular case, you find our transferritin level comes below the critical value of less than 15, and transferrin saturation comes below the less than 15. But her hemoglobin is still 12. कहने का क्या मतलब है? Your hemoglobin may be perfectly normal, but their stores or storage iron, transport and functional iron is markedly compromised. And the come stage goes still further if no action is taken. And then you find that not only transferritin is low, then transferrin saturation is low, and your hemoglobin is low. When hemoglobin drops below 12 gram percent, it gives your antennas are all open both sides. That is cut transport and functional iron is also come to the lowest minimum, and storage iron is zero. Is this investigation part clear? Hello?
Yes,
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes. One of the $1 million slides, and this is what I wish to tell you, that hemoglobin आप 12 gram percent को नाचने की जरूरत नहीं है, because आपको जाना उस स्टेज में भी पता पड़ेगा कि 12 अगर उसका ग्राम हीमोग्लोबिन है, to for you to find out कि भैया इसके स्टोरेज आयरन और फंक्शनल आयरन और ट्रांसपोर्ट आयरन में क्या कमी है, उसके लिए आपको ये दो इन्वेस्टिगेशंस करानी पड़ेगी. That's it. Now, so by the time the hemoglobin is less than 12 gram percent, already lots of damage has taken place. And I don't have to dilate on it. What does anemia do? It is mainly goes around fatigue, weakness, and things related to that. Now, this is again slide which I had just now given. It is reiterating the same thing, because I want, by the time you get up from this particular class, it should be ingrained in your brain that impact of anemia is diminished concentration, disturbance in perception, and a poor learning ability, affecting the school and the college grades badly. Secondly, it reduces the physical development, and it decreases the work output and decreases the work capacity. Thirdly, it is impairs sexual and reproductive development. This lady will present as irregular menstruation, and कहते हैं ना कि आपका AUB के साथ आए तो आपका hemoglobin में भी the less hemoglobin may be the cause. So this is very true. And low pre-pregnancy iron stores, and this lady who starts with anemia and all exhausted store of the stores get exhausted from reticular endothelial system and your transport iron, and then you find that not only you are not prepared for motherhood, and that's why you produce low birth weight babies and preterm babies. So the cycle of intergenerational anemia goes on and on and on and on. Now, so when we talk about Mission Gulabo for this adolescent girls, we must remember that anemia badly affects the school performance. It makes her lazy, and there is an inadequate preparation for motherhood. And if you're looking for a height, again, I will come to the China model, how they have improved their height. So if we have to stop intergenerational anemia, we have to work on this adolescent girl. So our attitude and a public attitude need to change, because anemia is making a lazy race and affecting our school performance. And India at this particular time cannot afford to have these two things for us. Now, this is China role model. When they came to one child norm, at that time, the chief came onto the television, and he said, Chinese mothers have to stop giving Chinese food to the children. And if you want to increase the height of our children, you have to change the diet. So the diet was emphasized right almost 40 years back, and that is why you can find that Chinese boys and girls today, people who come as an athlete are not less than 6 feet, and they have really transformed everything. Uh, after that, their height has increased and their IQ levels are much, much higher. Anything which comes in terms of a brain, they can duplicate it, and now duplicate wala season bhi khatam ho gaya. Now they can innovate everything which is new, just like Americans. So if they can do it in China, we can surely do it in India. So again, I'd say that wake up. The story of Anemia Mukt Bharat, as far the adolescent girls are concerned, we have to write with our own hands. As far the Government of India initiative is concerned, they started way back in 1970, and then it was renamed as National Nutritional Anemia Control Program in 91, and then this star came from the Indian Medical Association. Later, Foxy and IAP also joined it. It became big program, and a lot of work had been done from 2000 to 2015 or 14 or 15. And you can see here that the different names have been given to it. And finally, Narendra Modi said, wherever I go and I'm accused that 50% of your population is kuposhit, so mujhe sharam aati hai. So then this man is leading from the front Anemia Mukt Bharat and Poshan Abhiyan. That is renamed at 2018, and the headquarter is now in Ahmedabad. Now, this is what I just wish to tell you, is that mainstay of all programs of the government have been so far only on the oral iron folic acid supplementation. So you can see here the pregnant ladies between up to 50 years, 88% was anemia. Economist Amrit Sen has said that 80%, 88% was anemia. And as far as adolescent, this IMA study, this is the DHA wala, Delhi gynecologist, and all studies have been done across the country, found the anemia rate of adolescent boys and girls had been the same. As far as the adolescent girls are concerned, in 2000, the figures were 90%. I told you 1964 also, when I joined the medical college, it was 90%. So it means in the last, in the 19th century, there had been no change, 90% only. But once they start, IMA took the initiative, a lot of work went on, iron folic acid was started distributing free, and they were incorporated in midday scale. So you can find that by the time in 2006, when this National Family Health Survey 3 came, the rate had dropped from 90% to 60%. Then they give the targets kind of a thing. In 16, it was 54%, it had dropped. And they thought, every time the drop has been going to be more. And it is now you can find this came as a shock, that the last survey, which was released in 21, to be exact, on 20th of November 20, they found it was a shock to each one of us that, anemia rate, instead of decreasing, have increased. This is the target which had been given in 22, that adolescent girls anemia, which was 54, they aimed at it at 36%. The aim was given in 22 was from 54% in adolescent girls, it should come to 36%, but it became 60%. It became 60%. And as for the boys were concerned, they were 29%. The target was 11%, and there also it increased to 30%. So I don't have to remind you that in 2018, this anemia and kuposhan in vulnerable age group was started with a big bang of a 666 strategy, 6 target beneficiaries, 6 institutional mechanism, and 6 interventions. Now, following this National Family Health Survey 5, the efforts were intensified and in terms of training and change strategies. So, the mantra had been after this training, training, and training. All speak the same language. All speak the same language. In fact, for everybody to speak the same language, they formed a booklet which was in Hindi and English, and the purpose was that it should reach out to each and every doctor in the country, and it should reach out to every nurse in the country, and everybody speaks the same language. It was produced in Hindi, it was produced in English, and public awareness have to be created by one and all, and not only ASHA workers. It has to be created by each and everybody. And I again come back to very simple things. What are our cutoff? The cutoff is 12, and mild anemia is anything less than 12 to 11. Moderate is from 9 to less than 11, and the severe is 8. Now, the second has been on not only give them iron folic acid supplementation, even if their hemoglobin is normal. This was a very big strategy change in 2018. That these people it was emphasized that they will be given midday meal में देंगे. उस टाइम hemoglobin की थी estimation की थी, इतना ज़्यादा emphasize नहीं किया था. But I think at this particular time it was emphasized the prophylactic iron folic acid tablet should be given even if your hemoglobin is normal. एक लड़की का हीमोग्लोबिन 13 है, 13.5 है, 14 है, तो भी उसको वीकली आयरन फोलिक एसिड की सप्लीमेंटेशन की जरूरत है. And this is not only one group, it is all 6 target age group. It has to be prophylactic iron and folic acid supplementation need to be given. And this campaign has to be intensified round the year. We have to improve the compliance to take iron folic acid, and deworming is, according to the WHO and the government of India, is twice a year, even if you're not anemic. These two things are must. Deworming twice a year, and Indian iron folic acid tablet, even if you're normal. And encourage increase in the intake of iron-rich food through diet and fortified foods. This is midday meal, and this is what the supplementation of iron folic acid and deworming is concerned. So this is now you find midday meal is a very routine across the country, and this is one of the game changer. We came in 2000, where midday meal came along with this came iron folic acid supplementation. So now this need to be intensified. And now there has been talk going on that every school should have a room, and where they are tested, they are treated. You talk about the nutrition and the monitoring, and all these girls and boys need to be tracked. Again, we need to walk the talk by point of care testing and the point of care treatment. People in the school health have to be really geared up on this particular thing. In anemia, in pregnancy, they have intensified and got it done in various states. At least Delhi is on the lead as far as this particular part is concerned. Now, as far as treatment part is concerned, again, highlight to each one of you, goes without saying that you require iron folic acid supplementation even if your hemoglobin is more than 12 gram %. But in case a patient is a child is a mild anemia, then iron folic acid 2 tablets to be given. 2 tablets have to be given. Unlike the adult dose, इसमें 60 milligram iron है, elemental iron, and there's a folic acid of 500 microgram. Moderate may again the same dosage has to be given of iron folic acid supplementation, 2 tablets, but all these patients need to be followed up. If you find that this particular patient after 3 months, the mild anemia and the moderate anemia, they have not improved, then they need to be referred to district hospital or a primary referral center. As for the severe anemia is concerned, the dictum has come that these patients should be referred by the school authorities and by the school doctors to the district hospital or the first referral center for the treatment. As for the normal hemoglobin concern, I again repeat, the iron folic supplementation has to be taken on a weekly basis. Now, deworming is the close follow-up के ऊपर बड़ा जोर है. On mild and moderate anemia of the girl, deworming is must along with the diet counseling. Moderate, if patient is there, she requires 2 tablets iron folic acid. She gets the deworming tablets. If no improvement is seen in 3 months of time, refer her to district hospital or first referral unit. If improvement to hemoglobin to normal, then provide her prophylactic iron folic acid dose and do the counseling as per the diet and deworming is concerned. Now, I want you to take a question with you. If total US population anemia rate is 5 to 7%, then why anemia in adolescent girls in our country is 60%? And the advisory has come to doctors especially and the healthcare workers. Again, it is in the form of writing. It shows, and for the school health scheme, the focus of the doctors for a moderate anemia is once referred by school administration after failure of giving iron folic acid tablets in therapeutic dose, अगर उसको फायदा नहीं हो रहा, 3 महीने में कोई improvement नहीं हो रहा, she must be going for injectable iron. No excuse, get it done, mindset should be there. Then as far as advisory for severe anemia is concerned, I told you severe anemia takes life, and that's why they need to, without this or that or any confusion, they need to be admit for iron therapy in case if there is no symptoms, and if she's symptomatic, then the blood pack cell need to be given. Again, there should be no excuse, get it done, attitude has to be there. So there should be a winning mindset of doctors and nurses. The only way to change is by public starts thinking differently and not casual about the Anemia Mukt Bharat. You can see here, the only change which has come is from from 2000 to 2050. The drop has been there from 90% to almost 54%. And after that, probably that kind of focus has not been there because our mindset for Indian girls is very casual. And both two of us, myself and Dr. Manju Puri, feels that it is very easy to diagnose, very easy to treat, provided we have a lago raho attitude. And we also that the Western world has already shown us that the total incidence of anemia in those countries is around 5% or less than 5%. Then why can't, if they can do it, why can't we do it? Now, again, to emphasize that you can see each and everything which all of us know about it, but I think in each person you should try to see these dark knuckles for a B12 deficiency. So whenever you have dark knuckles like this, it just speaks for itself that there is additional B12 deficiency. Now, we need to revive the peripheral blood smear has almost forgotten, and we have to again revive the peripheral blood smear, because if you want to know what is the cause of anemia, then peripheral blood smear need to be done, and expert comment should always be done. Point of care, getting digital hemoglobin, each one of us should have this kind of facility available in a clinic. And कई बार ऐसा देखा गया कि आपने डिजिटल हीमोग्लोबिन किया और जो CBC से उसका 1 ग्राम कम आ जाता है. So I think it re-emphasizes the moment you see the digital hemoglobin less, give her treatment and then ask her to get CBC done within 15 days, and she follows it up and take a credit for the same. So इससे इसका point of care test और point of care treatment का यही फायदा है कि before she leaves she knows what is her hemoglobin status. Now, thalassemia incidence in our city, it varies from place to place, but as far as Delhi is concerned, the thalassemia incidence varies anytime between up to 6 to 7%. Earlier it was 7%, but the other day Jyoti was telling that it is 4.5%. Each one of us must know what is Menzer index. Lal report has started giving it already in their reports. MCV divided by RBCs, if it is less than 14, then it is thalassemia, and if it is more than 14, it is iron deficiency anemia. It is MCV divided by RBCs. Very easy, one can do it oneself, and इसको अपने एक कार्ड में रख के मेज पे चिपका देना है जिससे कि आपको याद रहे. Remember these 5 A's. This was 5 A's was our mission as far as year 2000 IMA strategies were concerned. The first A was ask what is your hemoglobin. Ask when was it last done. Ask what is your normal hemoglobin should be of your age group people, and ask to get it done right away. And then once a person comes to know कि क्या होना चाहिए और उसका क्यों कम है, then you'll find when you give diet advice on diet, she will listen. Once you give an advice on the tablet, she will listen. And when you give advice for deworming, she will listen. One thing is very clear, I wish to tell you, डाइट आप कितनी भी अच्छी लेंगे, अगर आपका हीमोग्लोबिन 10 ग्राम है तो 10 से 9 नहीं होगा, पर 10 से 11 भी नहीं होगा on a diet alone. So each doctors must know about it. The diet plus iron folic acid supplementation and deworming is equally important. As far as the management of anemia is concerned, I think each one of you should know about it. कि प्रोटीन्स क्या हैं, प्रोटीन के बारे में क्या है, उसके क्या सोर्स हैं, क्या वेजिटेरियन के सोर्स हैं, क्या क्या नॉन वेजिटेरियन के सोर्स हैं. Each one of you should cannot ignore this particular aspect of your knowledge. Now, once we initiate the therapy, our aim is 12 gram by 12 years. We have to, our aim is to remember that severity of it is the severe anemia which kills the person. It is a moderate anemia and mild anemia which spoils the school grades. So we need to correct anemia, we have to restore iron reserves, and we have to correct associated B12 deficiency in case it shows on her or on her hands. Now here is the management strategy, and again there should not be any confusion. We need to tell them about the diet part of it. यहाँ पर अगर आपने उसको 4 sources प्रोटीन के नहीं बताए तो वो she will not going to get it in her practice. You have to speak about soya bean to her and how to take it. We will talk towards the end about this diet part of it. And you must speak about moong ki dal. You must speak about other things also. And green leafy vegetable was a great source. You must talk about deworming. Iron folic acid therapy for iron deficiency anemia, which is by and large is the iron deficiency anemia. It has to be given in a mild to moderate cases. But all these patients required assessment of response. If the response has not been there, patient goes for a parenteral iron therapy if she is not responding to moderate anemia. And I goes without saying that all severe anemia patients need to be admitted, whether she's a pregnant lady, whether it's an adolescent girl, where in a severe variety she gets admitted and then she gets a blood transfusion or parenteral iron therapy depending upon whether she has associated symptoms or not. Now deworming, I think all of you know about it, that it has to be for all ages. People have to take it. It has to be twice a year. The dose is 400 milligram of albendazole is given as one tablet only. Now, this is prophylaxis. Even if her hemoglobin is more than 12, she requires a weekly tablet. If she is treatment part of his mild anemia is also 2 tablets, she takes it, and moderate anemia also 2 tablets she takes it. Then again, retest is done. In case if the retest shows that she's not improving, she should have injectable iron. Severe anemia goes without saying that she need to be admitted either for iron therapy or for blood transfusion, which is Paxil blood transfusion. Now, as for the oral iron therapy is concerned, the supply of government supply is great, and this is no more khadiya now. This is quite good quality iron is there in these tablets, and the only thing we need to tell both in the government sector and in the private sector that आपको अगर गवर्नमेंट की सप्लाई से आप सरकारी डिस्पेंसरी में अगर जाके ले लोगे तो ये आपको फ्री ऑफ चार्ज मिल जाएगा, और इट इज इक्वली गुड. And otherwise, if you want to buy it, you must buy tablets which has got ferrous ascorbate, because in cases of deficiency, the absorption is close to 70%. So this is all pharmacopoeia speak the same thing, that you have to be very selective about which preparation you're picking up, and not the drug house, which those are people representatives who come. You should take the knowledge from them. They have to sell their own product, and for which they are paid. Now, anemia is totally preventable, yet it is a major problem in our country. And I think we need to know about the dietary aspect in a very big way. We want solid body and a smart mind for our young youth. And there are our diet is definitely low in iron diet, so we must know what all are. मैंने आपको बताया 2 3 4 वीडियोस है मेरे पास, so which need to study about them and know what are the good sources of iron are there. So this iron deficiency anemia is taken care of. ये चुकंदर है पालक. This is मूंगफली. ठीक है. Eat a rainbow diet. It should be always a balanced diet. And पढ़ने वाले बच्चों को ये सब चीज़ें खाना बहुत ज़रूरी है. एक उनको अंडा खाना है, और ये pulses, legumes, and 1 apple a day. All these kind of things are required in case if you have a school-going child. This is what you need to give them as a supplementation as a mother or a grandmother. Now, we all know that folic acid is definitely required, and all these greens are rich in not only in folic acid, but they're very, very rich in iron. Plus, they are loaded with vitamins. We also need to emphasize the importance of vitamin C with the meals, because once the acidic environment is there, then only the iron given in the diet will be absorbed. Nuts, ragi, dals are great source for vegetarian. They should not get demoralized. They need to get demoralized in case if they're eating food from outside. I think which is the biggest cause of all the problems, why our anemia is not going away. Nuts are already rich. Ragi is again full of proteins, and our dals are, I think we all underestimate. They are also big source of protein. What we need to remember is that खाने के साथ हमें you need to take that you must take plenty of vegetables and sprouts. Any चीज को sprout कर लेंगे उसकी nutritious value 10 times बढ़ जाएगी. And these are the source of vitamin C in your diet, and you need to take plenty of fruits, especially the citrus fruit. What you need not take is big no as for the tea and coffee is concerned after the meal, especially in the winter season. This you have to see to it that you see to it in your own family. लागू करें इसको. And chips and cola, again, worst combination of taking, and goes without saying, alcohol and cigarettes. This man is spearheading the movement of Mota Anaj. Less is said about things, they are magical. Fortified food, we must talk about it. As far as India is concerned, the fortification has been there in the rice, which is also a limited supply at the moment. We do not have fortification on a large scale till now. So let's pledge for this particular girl that she should be anemia-free child. There should be anemia-free family. There should be anemia-free school. And then only we'll have anemia-free India as far as the adolescent girls are concerned. And I leave you again with a question. Our aim is to bring down the total incidence of anemia in our country as less than 5%. And still we have more than half of our population is anemic. And out of that, 5 to 7% are severely anemic. Yes, we have come a very long way. In 2000, this severe anemia element had been little more than 20%, which has come down markedly. And as far as things are concerned, it is doable. Earlier, we used to say that in pregnancy, we used to say that 40% mortality direct, 20% direct, and 20% direct. And now 8% is the mortality as far as the anemia in pregnancy is concerned. So I think we go with this particular aim that let's have anemia incidence, overall anemia incidence in our country less than 5%. So think about these girls, the future of this particular country. This is mission Pale to Pink. I don't know whether Malti has been able to emphasize this. This is a part of Pale, and this is real pink is there. And this is what we say, and that's why we say it's a mission Gulabo. Thank you very much. When we do act, then only we are going to make our tricolor proud, and we will be real Indians at that time. Thank you very much.
Thank you, ma'am.